All right, let's get started. Good afternoon. Welcome to the Hankin Distinguished Lecture. We're thrilled that you could join us for this online event. My name is Ali Memari, a professor in Architecture Engineering Department and also Civil and Environmental Engineering Department, the Bernard and Henrietta Hankin Chair in Residential Building Construction at Penn State, and the Director of the Pennsylvania Housing Research Center, or PHRC, as we call it. The Hankin Distinguished Lecture was established in 2006 in honor of the late Bernard Hankin and his family for their generous support of the residential construction program at Penn State. Each year, a world-class speaker is invited to present this lecture on a topic of great importance to the housing industry. This lecture will be recorded, and after closed captioning, the video will be available on the PHRC website along with 14 previous lectures. Before introducing our distinguished speaker, I would like to take a few minutes to explain the residential construction program made possible by the generous support of the Hankin Endowment at Penn State. The Hankin Chair position was established in 1989 with $1 million endowment given to Penn State by the late Bernard Hankin and his family to support engineering excellence through education, research, and public service in residential construction. It was Mr. Hankin's dream, or as it is called, Bernie's dream, to see more architecture, engineering, and civil engineering students educated in and pursue residential construction as a career. We work toward bringing Bernie's dream to reality and bettering the residential construction industry through various activities, such as offering courses related to residential building and subdivision design and construction management, offering research opportunities to graduate and undergraduate students, providing laboratory testing to industry to study their products, offering training programs and webinars to practitioners through our PHRC outreach activities, organizing PHRC conferences and workshops, publishing journal papers, conference proceedings, research reports, magazine articles, and builder briefs, participating at local, state, and national level professional societies and activities, and finally supporting our NAHB student chapter and their participation in NAHB student competition and DOE solar decathlon competition. Bernard Hankin not only provided direct support to Penn State for such activities, he also inspired and encouraged other individuals and companies to do the same. The residential construction program at Penn State is thankful for all of the support from the Hankin family, the Glunt family, NAHB's National Housing Endowment, Pennsylvania Builders Association, our local Builders Association of Central PA, and so many others. So thank you for joining us for our first virtual Hankin Distinguished Lecture. Our guests today include Penn State students, faculty, and staff, members of the residential construction industry, from builders to material suppliers, and the general public from across the United States. One housekeeping item before we begin: please submit questions via Q&A pod. Our distinguished speaker is willing to answer questions as the lecture will move forward. The staff of the PHRC will moderate the questions to be answered live by our speaker. Without further ado, I would like to introduce our speaker. Dr. Brett Singer is a staff scientist and head of sustainable energy and environmental systems, as well as lead of the Indoor Environment Group at the Lawrence Berkeley National Laboratory. Throughout the past decade, Dr. Singer has focused on how to synergistically improve indoor air quality and energy performance for high-performance homes, paying special attention to kitchen ventilation, filtration, and the performance of low-cost air quality monitors for smart home applications. He has conducted and directed research to improve the understanding of air pollutant emissions and controls, and the real-world physical, chemical processes that impact exposures in both outdoor and indoor environments. His postdoctoral work absorption and desorption processes impacting exposures to organic gases from tobacco brought increased attention to the importance surface materials have on indoor air quality and helped start the field of third-hand tobacco smoke research. Dr. Singer has also made impactful contributions to understanding pollutant exposures from cleaning products and combustion appliances. He earned a Bachelor of Arts in Engineering from Temple University and master's and doctoral degrees in civil and environmental engineering from University of California at Berkeley. With this introduction, let's welcome Dr. Singer to present the 2020 Hankin Distinguished Lecture entitled Advances, Challenges, and Opportunities for Indoor Air Quality in the U.S. Homes. Brett, take it away.
Well, thank you very much. It's really an honor to be here. I'm you heard Temple University. I'm from Pennsylvania. I grew up in Philadelphia. Great love for the state of Pennsylvania. And I wish I could be in person there. And hopefully sometime in the future, I'll get to visit State College. In the meantime, I'm really glad to be here virtually and to present this lecture. Before proceeding, I just want to acknowledge the work you see here was done. I don't have the slide of all the faces, and I'm embarrassed to say that, but there are many, many colleagues who contributed to that work. There'll be citations for papers that this is just, I was a member of many teams and proud to be. And then, of course, the sponsors. This work was funded. Lots of funding from the state of California, California Energy Commission, the United States Environmental Protection Agency, U.S. Department of Housing, Urban Development, and really extensive funding over the years from the Building America Department, U.S. Department of Energy. And shout out to Eric Werling, who is a Penn State alum from his master's work at the PHRC. And I'm not sure if he's watching now, but he's a big supporter of our program. And I know that he had a great experience at Penn State. So I'm going to go on. So the gentleman up in the left, his name is Rich Corsi. He's one of the real giants of the field of indoor air quality. He was at the University of Texas for many years, now at Portland State University, Dean of Engineering. And this is a slide that he uses. We call it the Corsi Code. A credit to Glenn Morrison for coining that name of the Corsi Code. But you see a bunch of numbers in your screen here. I'm going to give you the first number, which is the average life expectancy. If we were in person, I would ask for guesses as to what the next numbers are. But since we're virtual, I'm just going to have to reveal it to you. So the next one is the number of years of your life that most of us spend indoors, which is really pretty extraordinary. It's 69 of those 79 years will be spent in one indoor environment or another. 54 of those will be at home. 26 will be in bed, maybe more or less, depending on how much you sleep. About 4 in vehicles, and only about 6 outside. So a lot of attention to air quality, of course, happens outside, but really most of the time when we're breathing air, it's happening inside. So that's my first home. When I grew up there, this is in Northeast Philadelphia, working class neighborhood, row houses you see. When I grew up, this is an image from Google, as you can see. When I grew up, there were these really nice trees in the front. The trees were not well sized, so they broke up the sidewalks. They've since removed all those trees. But that's my house. That's me growing up as a kid. You see here, I'm going to talk about kitchen ventilation later. That was our kitchen ventilation. These are little fans in the wall with dampers of a sort that when you turn the switch on, the damper pops open and the fan exhausts outside. And in these houses, these are 3-bedroom houses, two small and one quote unquote master bedroom, and that's what we have for thermal air conditioning. The house, of course, all have heat. This is the indoor environment of my youth. Not sure how many of you recognize this actor named John Wayne. I didn't grow up with John Wayne, but my father had a cigarette in his mouth. He was a big fan of John Wayne and had a cigarette in his mouth pretty much all the time. 2-3 packs a day when I was growing up. So I was one of those people exposed to tremendous amounts of secondhand smoke. And when I was growing up, it was actually I'm 52. When I was growing up, it was actually rude to ask someone not to smoke in your house unless you had some kind of serious health condition. But generally it was accepted. And as we'll talk about, that's no longer the case. I think everybody knows that. So I'm going to talk a lot about indoor air quality. What is indoor air quality? Well, it starts with, I think, comfort. In this business, we talk about thermal comfort often separately, but there's a tremendous amount of research showing that people's perception of the quality of the air starts with their perception of temperature. So if they're uncomfortable, most people will not say the air quality is good. Of course, we don't want the air to be stinky. We don't want to be allergic to it. We don't want any microbes or viruses in the air. And I think that's something that we're all keenly aware of right now. And we don't want the air to poison us. And then, generally it's nice that there's some kind of freshness to it. For some people, that's adding odorants. I think for a lot of people, it just means access to outdoor air in a sense that there's some air movement. So how much do we breathe? We actually breathe quite a lot. If you take about a half a liter per breath, 16 breaths a minute, you do the calculation, you're breathing about the volume of air that's in that bedroom over there every day. So that's a lot of air going in and out of your body. And this is one of the reasons why air quality is so important, because it's the medium of the environment that we most profoundly have come into and out of our body over the course of a day. I'm going to be talking a lot about pollutant concentrations. So just to give you some sense, this is an actual example that was created by Kim Preshoff and TED Ed community. I really like it. 1 part per million is 1 molecule of chemical per million molecules of air. To give you a sense of what that means, if you look at the collection of Harry Potter books, which I recommend if anybody has not read them, it's about 1 million words. So the word hippogriff is literally 1 part per million, 1 word among the 1 million words in that series. There's another unit we use is microgram per meter cubed, which is 1 microgram of pollutant. It could be a liquid or a solid or a gas inside the air. So a grain of sand might be a milligram, which is 1,000 micrograms. And that really nice house there, that's not my house, I can assure you. But I can walk to houses like that. It's quite a far walk, but I can walk there. So that house is about 1,100 meters cubed. So that's approximately 1 grain of sand in that giant house is approximately 1 microgram per meter cubed. Now, sand is a really big thing. A milligram is a large quantity. If we're talking about wildfire smoke, that would be 10 to the 11th smoke particles. So because it goes with the diameter cubed, right, for volume of a sphere, you really get, as you get particles get smaller, smoke particles are about 200 to 300 0.2 to 0.3 micrometers in diameter, so 200 to 300 nanometers. There'll be 10 to the 11th in that milligram there. So what do we have to worry about? Well, there's a whole bunch of chemicals. Probably all heard of the particulate matter or PM10, PM2.5. These are different sizes. Ultrafine particles are very small particles that can actually move around your body in ways that the other ones can't. Within particulate matter, there's components that are harmful to us, certainly different metals, polycyclic aromatic hydrocarbons, organic acids, soot, and then you get into things like nitrogen dioxide, carbon monoxide. I'm going to be talking about some of these things later. Gas phase organics or volatile organic compounds. Formaldehyde's a big one. And then you get radon is a big issue residentially. And then also there are biological contaminants, starting with mold and dampness. Allergens is a really big issue. And then bioeffluents, including CO2, can really make an indoor environment unpleasant. And again, sadly, we're all quite aware now that viruses are a really big issue, and indoor exposures is a big deal. Really important principle of exposure I hear a lot where people talk about, oh, we're exposed to X, Y, or Z chemical. We're constantly exposed to all kinds of, right now I'm inside my office, I'm breathing in not only soot, but there's some, potentially measurable quantity of nicotine that I'm breathing in. It's a non-smoking building. I don't know if there's ever been smoking in this building, but there are nicotine molecules floating around the air. So am I worried about that? I'm not, because core principle of toxicology is that the dose makes the poison. So just being exposed to something doesn't necessarily mean it's harmful. Again, we're talking about the virus. Even if 1 or 2 virions of SARS virus gets into my nose, I'm probably not going to get sick. But if 500 or 1,000 or 10,000, then I probably have something to worry about. So we have to really pay attention to concentration and how much we're exposed to. A really important point: the risks of air pollution are not evenly distributed. So we might talk about average or typical, but the reality is there are some people who have very high exposures, and generally many people have very low exposures to most of the chemicals that we're concerned about indoors generally. And then both the concentrations and exposures vary, and also very important, susceptibility varies. So again, this talk is not about COVID or SARS-CoV-2, but I think we're all, again, acutely aware that not everybody is equally sensitive or susceptible even to getting sick, let alone to the damage that will be done by the illness. So which indoor air pollutants are most important for our health or most impact our health? It's getting a little dated now. Back in 2012, this paper came out. We use this concept of disability adjusted life years, which allows us to compare across different pollutants. So it's a way of comparing the impact, let's say, of having some reduced lifestyle because you have asthma or some other kind of illness that reduces your capacity, and combining that with something that actually could prematurely take your life. So it's a combination of years of life lost, and then the degradation of the quality of your life from having illness. And people work out how to do those equations of how much dolly each type of illness is worth. But it allows us to compare across pollutants that have different health outcomes. When we did this analysis, we found that using kind of typical values from the literature at the time, this particular matter, PM2.5, was by far the most important air pollutant in terms of the damage that was done. Next was secondhand smoke, mold and moisture, radon, formaldehyde, and then this chemical called acrolein, ozone, and NO2. Acrolein is an irritant. Ozone is an irritant. NO2 is an irritant. Radon causes cancer. Very different. One of the questions that always comes up is, well, how can it possibly be that PM2.5 is worse than secondhand smoke? Secondhand smoke, of course, contains PM2.5. So wouldn't that be worse? But the reason is because basically many more people we all have PM2.5 in our homes in substantial quantities, but many people don't have substantial quantities of secondhand smoke, thankfully. So that's why PM2.5 can be more harmful. So talking about PM2.5, there's a nice schematic from EPA. You can see the human hair. You can see those big blue balls are 10 micron particles. I mentioned the beach sand. There's a 90 micrometer diameter piece of sand. And then the PM2.5 is those little red balls stretched across the blue one. We know it's harmful because when PM2.5 goes up, when we measure higher concentrations outdoors, we see more deaths, strokes, other cardiovascular illness, hospital admissions for respiratory illness, severity of chronic lung disease, and many other illnesses and impacts. What's very helpful is not only do we have the epidemiology of seeing the impacts that occur when concentrations rise in the environment, but we also now have mechanisms to explain a lot of these things. So it's kind of a rock solid case. We know that more PM2.5, more people get sick, and we can actually explain quite a few of the illnesses that we see. So that tells us for sure it's that. Indoor, what are the sources? Well, the two on the left, basically outdoor air pollution. So photochemical air pollution, you see the bus there. Also wildfire smoke is a big problem outdoors now. But then indoors, smoking, right, used to be very glamorous, not so much anymore. Candles actually produce a lot of particulate matter, and cooking does as well. And I'll talk a little bit more about cooking coming up. And there's some data that's data from a very, very large study with hundreds of homes. The two top groups are homes that had smokers. The bottom groups are homes that did not have smokers. And on the bottom, the difference between the black and the red is that the black were homes where people fried 2 or more times per week. And then you're seeing average levels, and you see this kind of big slug around lunch and a bigger slug around dinner and a smaller slug around breakfast, which is the times that people will be cooking. So indoors, particulate matter is actually impacted by many processes. I'm not going to go into detail here, but I just wanted to convey the complexity that comes in from outdoors. There's can coagulate, that changes the nature of the particulate matter. You can have a deposit, and then on the floor, it's quite a, if I go out for any reason. Indoors in residences is nitrogen dioxide. It's an airway irritant. It exacerbates asthma and other respiratory disease, leads to cough, wheeze. It may cause asthma and increase infections. And then, of course, asthmatics, COPD patients. And again, for at least some of the impacts, we've worked out, not we, my group, but people, the scientific community has worked out the mechanism. So we have a pretty rock solid case that nitrogen dioxide is harmful. It's regulated in outdoor air, and it's present at levels indoors that we have found cause harm to people. Big sources are unvented gas burners, including your cooking. We'll talk a lot about that. Tobacco smoke again, and then vent-free heaters, fireplaces. There was a really nice study done in Illinois, 30 homes that had unvented fireplaces. 4 random days of monitoring. They weren't looking for high emitting homes or particularly, problematic homes. Literally, they were just looking for homes that had these vent-free fireplaces. And then in 4 days of monitoring, 80% of the homes had at least 1 hour where the nitrogen dioxide was above 100 ppb, which is important because that's the threshold that we have for outdoor air quality. So within people's homes, they were routinely having nitrogen dioxide exposures that are not allowed outdoors. Now, that's not illegal indoors because there's not a regulation requiring clean air indoors as there is outdoors, but it's no less harmful. Radon is a really well-studied pollutant. Actually, we did a lot of work on radon here at Berkeley Lab, primarily in the late 80s. It's actually, as you saw earlier, still causes a lot of harm. Thankfully, we have a pretty well-developed mechanism for dealing with it. On rate of radon entry varies from the soil. It comes up into homes through cracks in the foundation or connections to the soil, and basically gets sucked up into the house. And then the action level for EPA is 4 microgram picocuries per liter, sorry. And the effect is believed to be more severe, significantly more severe for people who smoke than for people who don't smoke. And there's a map you see where researchers have mapped out areas of higher radon based on both soil considerations and predominantly, though, on sampling. Formaldehyde was a really big problem back in the 70s because for years we had put urea formaldehyde foam insulation into buildings. And then when we started tightening buildings back in the 1970s, because of the oil crisis and the need for energy efficiency, formaldehyde levels really jumped up. It was banned in 1980 in Canada and in 1983 in the US. So we've largely replaced a lot of that urea from foam insulation, but it's also used as a binder in manufactured wood products. So that leads to concentrations still in homes that have these manufactured wood products. And there are guidelines that in California, the guidelines are much lower than in other places. So Germany, UK, World Health Organization, they have an 80 ppb chronic exposure ppb. So it's derives from just differences in the uncertainty in going from the animal studies that they use for toxicity to human. And I just see a couple questions came in. I missed them. What exactly qualifies a particle as PM 2.5? Thank you. Excellent question. The question, I'm not sure how to dismiss the question. Basically, it's a particle that is collected onto a filter that has gone through a mechanism to separate water particles from small particles with aerodynamic. It behaves like a sphere that is a 2.5 micrometer diameter sphere. So there's kind of an operationally defined, but basically it's a particle that you can inhale into your lungs. It gets past the upper respiratory system and can go it down into the lower respiratory system. And that's why we have that regulation for PM.5. And then the next question, answer that one. Okay, and then the next question, what's the trick versus a gas on air quality? So for the gas heaters, if they are vented as they should be, so that the exhaust products from combustion are routed to the outdoors through ducting, then gas heaters can be very safe. They still contribute to outdoor air pollution, of course, whereas the electric heater doesn't need to be ducted because it's not a combustion process. Okay, great. Thank you, Rachel, for bringing that question. Okay, so going back to here, we did formaldehyde. Okay, I mentioned the variations in guidelines. So reducing IAQ risks. How do we reduce risks? And just a note here, when we talk about good indoor air quality, if you think back, in some ways you could think of good indoor air quality as being the absence of problematic air quality or hazard. So how do we reduce the risk that will interfere with our good air quality? Available home HVAC air filters, which I will get to. So the really simple one, the Department of Housing and Urban Development has this very nice keep it list, they call it. Keep it dry, keep it clean. Keep it dry is primarily so we don't have dampness and mold and microbiological problems. Keep it clean, dirty, clutter and dirt both attract pests and then potentially other problems. Safe from contaminant-free and well-maintained. And then is there a risk profile for different major issues? Yeah, so issues just PM 2.5. So that be in the center of a major city, or in California, we've had really bad problems with wildfires in recent years. Then that's a challenge that maybe you don't have a wildfire challenge if you live in Maine. Okay, but maybe Maine, some places, have more condensation or dampness issues. So whereas we would have fewer of those here in California, which is a drier climate. So it does vary a lot. Okay, Chuck says can't hear. Don't know if that's a connection issue.
Brett, we were having some
Okay.
audio glitches, and we stopped your video to open up some bandwidth. So we're addressing that right now. You're coming through pretty clear now.
Great. Sorry about that. I am plugged in, so I'm not. I go back to Wi-Fi if the plug is not working. Okay, great. So I'm going to. Actually, I'm going to stay here. So how do we reduce our risk? Well, we start with source reduction. We reduce whatever the product or activity that's introducing hazard into our lives. We try to remove that. And then we try to, if we can't do that, we try to ventilate that, exhaust that directly, like that gas burners that I mentioned. When that doesn't work, we use some filtration or air cleaning, and then we can ventilation as well. Source reduction. We mentioned smoking. By far, it used to be the predominant air quality problem in homes, still is in homes where people smoke. But thankfully, many homes now have smoking bans. And this is a little dated, right? So you see the most recent year here was 2006 and 7. But even back then, we saw that in non-smoking homes, we were talking about 90+%, and I think even has increased since then. With a definite difference between college graduates and less than college homes. And even in smoker households, over in the really increases. So the smokers, what really happens there is that smokers realized their family. Someone may say, okay, I don't care about myself. I'm willing to take the risk. But many of the smokers would not be willing to put their families at risk. So once they got the message, they were, much more willing to move outside of it. Okay. Right. Advance that. Smoking bans have been known for nationwide. There are bans in public housing. More and more cities and municipalities are doing that. And then over on the right there, what you're looking at is cotinine levels in non-smokers. You see is that over time, from the late 80s even to the early 2010s, really sharp reductions in the percentage of non-smokers who had cotinine, and we think that's largely because of more and more buildings or more places that are smoke-free, so we can go through our lives without having to breathe tobacco smoke. There's low organic compounds inside UMs. This is data compared from the early 80s to the late 90s, 2000. And then across a range of these chemicals that are sometimes present at levels that can be harmful, we see big reductions, partly because VOCs have been reduced outside. So there's fewer VOCs coming in from outdoor air into our homes. But it's also because we've greatly reduced VOCs in products. And if you look in the middle there, benzene is a really great success story. We used to put benzene in products as a solvent, but it's a carcinogen. We recognize that it's harmful, so it's pretty much shouldn't be in any products now. So we see much lower levels of benzene in homes. And then there's a question about MERV filters, different MERV ratings, and I get to that shortly. It's true in Canada as well. So now there's a very big national study. This was in 1992. They sent samplers to 757 homes. In 2009-11, and 3,800 plus homes. So really big data set. And again, seeing much lower concentrations of almost all the VOCs, with the exception of styrene, which was a little higher. So another really big success story for source control is formaldehyde. California, I mentioned the wood products. California instituted regulations on how much formaldehyde could be in composite wood products. That rule went into effect January 2009. Took a few years for it to be fully in effect. U.S. Formaldehyde Control Act was 2010. Again, it took a number of years, but products were labeled starting in June 1st, 2018. And then with increases in the U.S. regulations, very similar to California. Happily, we also have data. This is some data that my group collected showing that this works. What you're looking at is formaldehyde levels in individual homes as a function of the air exchange rate. So this is emitted from indoor sources. So as you increase the air exchange rate to the right, you're going to have lower concentrations. As you reduce the ventilation rate, you're going to have higher concentrations. And the black are homes built with conventional materials, and the red are homes built with low emitting materials. You see some overlap, but across those two lines there for the two groups, you see about a 24% reduction at what we consider to be a typical closed house air change rate of about 0.3 air changes per hour. And then when we made adjustments for temperature and humidity at the time of sampling and for house age, the reduction actually looks a little bit larger. It might be as much as 40% reduction. So for particulate matter, I mentioned it's outside. So reducing entry from outdoors is very helpful. Large fraction of indoor PM comes from outdoors. Exactly what that fraction is depends both where you live, so how much you have outdoors, and of course, how much you emit indoors. But numbers in different places from these pretty large studies vary from 30% in Houston in one study up to 80% from another study in multiple cities. So it really depends kind of on the population you're looking at and time of year, et cetera. This is some data from a study we conducted in Sacramento in an unoccupied house that we outfitted with way too much equipment for a year. It was a 2006 house, very typical California house, about 1,200 square feet is not necessarily typical. It's a little on the small side, but 5 air changes per hour at a 50 Pascal pressure difference. That's like a test point. So this is like a moderately tight house, but not an extremely tight house. We did some duct sealing. And then when we operated it with exhaust ventilation as required in California, but not any special filtration, we found that just that condition, over on the right, you look on the bottom, you see the top of the line is the outdoor concentration, and the bottom of the line is the indoor concentration. The house is unoccupied, so you don't see any indoor sources, so the only PM is coming from outside. You see substantially lower PM inside than outside. And then as there's a little bit of a time delay, but we can look 24-hour average. And then we see there's consistently about 60 to 80% reduction and an average about 30% reduction in PM2.5 in this house unoccupied. So just having the house closed from deposition and some of those other processes I mentioned earlier lead to lower pollutant concentrations. Envelopes are getting tighter. You're looking at data here from before the 60s up through 2000 to 2011. And as you move to the left, it's less ventilation and tighter house. So that's helping reduce our exposure to outdoor particulate matter and also outdoor nitrogen dioxide. Radon, we have pretty well developed controls. Basically, there's a system where you vent the subsurface up above the house. That could be done passively or actively, and that system works very well. There's EPA recommends that if you're in that zone 1 from that map I showed you earlier, that you install a passive system and then test. If you have radon, high radon inside the house, even with that passive system, then you can add a active system. You put a fan in there, and then there's a whole sort of set of guidance for how to test and take care of that. Again, not being implemented perfectly, but many homes are tested and mitigated every year that would previously have resulted in really high exposures to radon and a lot of cancer. Kitchen ventilation. So cooking and burners are important sources. If everything's going well, then we're going to produce carbon dioxide and water vapor. But if everything's going well, they're also going to produce nitrogen oxides and some amount of formaldehyde. So a nice clean burning flame, some ultrafine particles. Turns out the electric burners also produce these ultrafine particles. And even the cooking itself produces particles, formaldehyde, acetaldehyde, that acrolein produced from cooking oils, PAH, et cetera. So there's a lot of contaminants that are produced. And if you, especially if you cut smoking out of your home and you don't burn candles every day or incense, cooking can be the largest source of many pollutants inside your home. Just evidence of this. This is a study we did in California. We mailed out samplers to 350 homes. Some of them had all electric. A lot of them had gas cooking. And you're looking at the incremental, the incremental nitrogen dioxide in the bedroom. So it's factoring out what's coming from outdoors, just looking at what's coming from indoors. And you see that as you cooked more, or as these people cooked more, they had higher nitrogen dioxide. Lots of other studies have shown this. So it's clearly coming from the cooking burners. More cooking with gas gives you more nitrogen dioxide. Lots of ways to deal with this: venting range hoods, venting microwaves. Many microwaves do not vent outdoors; they just blow air back into the kitchen. But they're configured where they have a vent, and they could be connected to an outdoor vent. You could have downdraft. You can have that exhaust fan on the wall, like I had at my row house in Philadelphia. Obviously, you can open a window. You get into something fast like an ERV. Ceiling exhaust can work. My group has done a lot of studies to try to understand the performance of these venting range hoods. We use a term called capture efficiency, which is the fraction of pollutants that are generated at the cooktop that are removed, or captured and removed and vented outside. And then whatever is not removed, of course, goes inside. So we want very high capture efficiency. We've done work in residences, kind of on site, and then also done work in the lab to understand their performance. This is data from one of those studies. On the top, you see capture efficiency when cooking on back burners. And we simulated cooking by just heating pots of water, like you see over there on the left, in the picture on the left behind the arrows. And then on the right is the front burners. Two big features. And you're looking at capture efficiency on the y-axis compared to airflow through the hood. On the top is cubic feet per minute, and on the bottom is liters per second. Depending on the European or Canadian or American, you can find your right units. And what you see is that starting with the back burners, increasing airflow gets you better performance. And on the front burners, there's significantly lower performance and a lot more variability. That line on the left, the gray line at 100 cubic feet per minute, that's what the minimum standard is with a lot of ventilation standards. And you see that even if you cook on your back burners, you're only getting 60% effectiveness or efficiency. And on the front burners, it's like 30% for a lot of these range hoods. So probably not good enough just to have that 100 CFM. I love this plot because this was data from the first field study we did. And you see we did different combinations of back and front burner. The data has a little different structure here. It's still capture efficiency, but then each house that we went to has a different code. D's were the downdrafts, F's were the flat profile, B's were things that had big bowls or sumps. And then you see off to the right, there's some above 60%. And there's several hoods like F4, where the best condition was 50%, and quite a few of the conditions were lower than that. So really all over the map, but a lot of these ranges are not doing great. I see a question about balancing maximum ventilation with energy efficient climate controls. Seems like pushing lots of air in and out of a home would greatly increase demand on HVAC systems. That's certainly true. And it's an issue we have now with again, I keep coming back to COVID because it's obviously the issue is appropriately on so many people's minds now, where we want to adequately ventilate, but that especially as we're going into winter can really create comfort issues. What we generally try to do when it's non-COVID times is provide a minimum level of ventilation so that there's always some air moving through the house. Under normal circumstances, 0.3 air changes per hour is probably fine. In a residence, in commercial buildings, when you have people together, or even if it's a residence, like let's say it's a small apartment with a lot of people in it, you're going to want to have a higher air change rate. In a classroom, typically we go to much higher ventilation rates, 3 or 4 air changes per hour, because we have many more people together. So it is a balance. As I'll show in a slide coming up, though, we can often cover what from the ventilation with filtration. So this is just some experiments we did in houses. We bring our equipment out on the carts we measured in the kitchen and in an upstairs location far from the kitchen. That's what we used to do when we were measuring emissions. I just love that slide because we were not invited back to this house, by the way, in case you were wondering. So we measured the performance of range hood. There's off on the left, H1, you can see is a really nice, expensive, big hood that covers the burners. H2 and H6 are these micro. Instead of looking at efficiency, we're looking at percent reduction. So how much did operating the range hood reduce pollutants? I'm getting the unstable connection again. So let me know if I'm getting cut off. But that first hood that I pointed out does great, 80, 90%. Some of the other ones, less so. You see 2 and 5 are giving me in the 50 to 60%, maybe up to 70. But some of the others like 6, 8, and 9 are mostly below 50%. So there's a lot of deficiencies in that kitchen ventilation. The guidance, venting, you want to vent with a low hood that covers all the burners. Quiet is really important. If you're the user, you want to make sure you operate the hood, cook on the back burner, higher flow for more cooking. And then if you're a roofer, you want to make sure to not drop a bunch of roofing materials down into the. This is stuff that I pulled out of my rain vent in my house after the roof was replaced. This happened, I turned the range on, I heard a little gargling, and I thought, that's odd. And then this is what I pulled out, and that it's a 287 grams of materials. My guess is the damper was not opening much, if at all. So my range hood was essentially not working at all at that point until I could clear that out. When we ask people, do you use your range hood? About 1/3 of the people say they use it quite a lot. Some people say they use it only when it's needed, and about 1/3 of people say that they don't ever use it for various reasons. And the main reason people say they don't use the range hood is that they say, oh, it's not needed. Sometimes it's too noisy. People don't think about it. Some significant minority of people kind of have this opinion that they sense that it doesn't work very well. And then we followed up. We did a study recently. I don't have a slide for it, but we were interested. We actually measured range hood use and compared the actual to the measured, to the self-report, and found that people use it a lot less than they say. But they do this not needed, and they do actually use it more when they cook more. And if they say they use it more than people who don't say they use it. Filtration, there was a question about improving filter quality. So this is a modeling study of how much benefit you get from putting better filtration in your HVAC system. And then also air tightening your home. I mentioned air tightness before. So better filtration is going to the right. We're looking at a unit called infiltration factor, which is the fraction of particulate matter inside your home compared to outside your home. And then you can greatly reduce that. I think these modeling numbers are probably a little bit on the optimistic side, but basically, as you air seal, you make these big jumps on the outdoor particles. And then as you improve filtration, you also get some benefit. But since your HVAC system is not operating all the time, you actually, unless you intentionally operate it, you get the benefit from the tighter house whenever your house is closed. So what we tell people is start with the air tightness, put a better filter in, and then when you need it, operate it. How effective is filtration? Well, there's lots of a growing number of studies. This was one of the earlier ones I thought was done very nicely. It was an intervention in 126 low-income homes with asthmatic children. They did baseline measurements and 3 seasonal follow-ups. Some of the homes had smokers, so there's the non-smoking and then the smoking column. So you see the difference between without filter use and with filter use is about a 50% reduction in each case, a little less for the non-smoking homes. This is actually significantly less than what they predicted. But one of the reasons is that they found that people actually turned them off. So there's a potential for filtration to drive down PM to very low levels. But the field studies find that the actual benefits are much smaller than the theoretical. And that's because, as I said, people turn them off. Sometimes the controls are noisy. I don't think there's many people who turn energy, but it is possible. EPA has a really nice guide to this, and I don't have a picture, but I just noticed today that CDC also just came out with a nice guide to using air cleaning for wildfire smoke. General ventilation. People don't open their windows unless it's really nice out for the most part. This is data that collected by my colleague Glenn Morrison, who is now at University of North Carolina. And what you see is that fraction of the windows open. This was kind of a spot check where they did a survey on Amazon Mechanical Turk. They asked people, were any windows open at all yesterday? And then they knew where people were responding so they could look at what the temperatures were. And they found that when temperatures were really nice, maybe about 60% of the people nationally would open their windows. And then, but dropping sharply as it got, a little bit colder or a little bit warmer. And that's if they were opened at all. That wasn't like, so that's even a crack. And then off on the right, you see some regional differences. I asked some colleagues in Atlanta about, what periods of the year do you open windows in Atlanta? And their answer was never. Now that's not everybody in Atlanta, I'm sure. These are people who had nice climate control systems, but it really does vary quite a lot regionally with different practices. So why mechanical ventilation? We keep talking about air sealing, but as you air seal, you can actually get homes to be tight enough that unless you intentionally ventilate them, it could be a problem. And I'll show you data in just a minute to reinforce that. That's because by air sealing it and closing it up, you reduce the amount of outdoor air, which reduces the dilution of indoor sources. Mechanical ventilation can help reduce the risk resulting from that. It's required in the ventilation standard from the ASHRAE organization. And then, as I've already mentioned, kitchen ventilation is very important. Bath exhaust also important. There's really lots of places that not require ventilation statewide. Relatively few states do. That's increasing as more states adopt more recent versions of the International Energy Conservation Code. And then in this plot, it's really just the green states and those light yellow, which there are none, that have it as a requirement. This may not be perfectly up to date, but really it's not required in more places than it is required. There's many problems with installed systems. The Florida Solar Energy Center did a really nice study back in early 2000s where they went to 21 homes that had mechanical ventilation. Only 3 had flows that were close to required. 2 of those were turned off. Only 12 were capable of operating. They found failed controllers and dampers, partially disconnected or crushed ducts, dirty filters, air intake above the exhaust. Just lots and lots of problems. Now, I point out that was before it was required. It started to be required in the state in 2015. A more recent study found things were much better than they were back early on. Still, there are problems in almost all the homes that they visited. California, we've done a number of studies in California. off on the left is results from a survey back in 2004 and 5, 1,500 responses. More data about how people don't naturally ventilate. 50% said that they didn't open their windows at all in winter. And this is, again, in California, where we have generally mild winters. And 20% didn't even open them in spring at all. We have really gorgeous weather. Kitchen and bath fans not used routinely. And why does that matter? Well, off on the right there, you're looking at a plot of formaldehyde concentrations in these homes. Red homes are data collected in the summer. Blue are data collected in the winter. And again, you see higher concentrations in the homes and concentration in the homes with really low. I'm getting unstable again. Let's try that. Hopefully it's okay. Concentrations in homes with low air exchange rates, lower as you increase ventilation, but you see a lot of data here part in the less than 0.4, and that there's that low level of the green down there, but the red is an acute reference exposure level that is still exceeded in a lot of homes, and that Canadian standard, which, you know, so it's above quite a few standards there. That's that area there. So we did a study starting in 2008. The Energy Commission in California started requiring mechanical ventilation in all new homes. We did a study subsequent to that to see if that was adequately protecting indoor air quality. Again, funded by a lot of those same institutions I mentioned earlier. Also got some co-funding from PG&E and SoCalGas. And the Gas Technology Institute was a really great partner in that work. And that's described in a paper that recently came out in the journal Indoor Air. We went into 70 homes that had mechanical ventilation at different parts of the state. These were all single family detached homes built in 2011 and 2017. They all had natural gas cooking burners. Sampling occurred year round. We measured indoor air quality and tracked activities over the course of the week. Just to make sure that we weren't conflating two things together, we asked for volunteers who generally keep their windows closed or would be willing to keep their windows closed. And we made sure that mechanical ventilation was operating. So we conducted a whole bunch of diagnostic tests on the air tightness of the house, the air flows of the different fans. We measured indoor air quality with UCR advanced crate-based data collection system, instrument protection system there. It's very open, so it was helpful, freestanding, and easy to transport. We measured PM 2.5, CO2, formaldehyde, and NO2. Measured activities, the range hood use, the cooking burners, fan use, etc. We measured other ventilation. So when you operate your clothes dryer, that's going to take air out of the house. That's a form of ventilation. We measured when heating and cooling was happening. We asked people to tell us when they did various things. Main finding, we found that actually almost all of the homes, first of all, they almost all had exhaust fans. They all had ventilation, pretty much all had ventilation at the standard. So that was really good operationally. The average required was 63 cubic feet per minute. The actual provider was substantially higher than that. So they were actually above the standard, about 50% above. And so Carl is asking, you mentioned air tightness can prevent outdoor pollutants from coming inside, and that seems to undermine the necessities to open windows. So yeah, I mean, basically what we want people to do is we want people to open windows when it's pleasant outside and when the air quality is good, and then keep windows closed when it's unpleasant outside, very hot, very cold, maybe very humid. And then when there's a bad outdoor air quality, that could be allergens, it could be wildfire smoke, it could be urban air pollution. So for the pollutants, I showed you that plot of that prior study that was done with the red and blue dots. That study was done before the formaldehyde regulations were in place and before homes were mechanically ventilated. So we see formaldehyde, the median, this is the median, went from about 36 ppb to 18. So really substantial reduction. Turns out we also had lower PM 2.5. NO2 was a little bit higher, but that's very impressive because the 2006 homes were almost all electric cooking and our homes were all gas cooking. So even with the source of the gas cooking, we see low NO2. And I think that's as much because people didn't cook a lot and they had really big houses for dilution as it was from, and probably somewhat from range hood use. So mission accomplished, right? Everything's good. Well, everything's better, but we're still not quite there. So you see, we're looking at the distribution of individual measurements in homes. That earlier study is in the black triangles. The blue circles are from our study. You see where the World Health Organization and other standards are at the 80 ppb. You see the Canadian long-term standard, but you still have this California chronic level that at least on paper, we're supposed to be below 7 pp. We're not there. I don't think we're going to get there easily, but so there's still, at least on the books, some concern. Maybe more importantly, there's still a lot of issues with satisfaction with air quality. A fairly large percentage of people said it was too hot in summer in their houses. A smaller percentage, but still substantial, said it was too cold in winter, not enough air movement. Even a percentage said too hot in winter. So there's still some dissatisfaction. Another really important feature is we found that when we showed up at the house, only 1 in 4 of the homes had their central system operating. So we turned them on for the study because that's what we were looking at, but there was not widespread use under normal circumstances. Lots of reasons for this, but certainly one of the reasons is that a lot of the homes had their ventilation fan controlled by a simple switch on the wall, and typically in the laundry room. And in a lot of cases, there was no label for that switch. So there was nothing indicating to the people that that was the whole house ventilation switch. So for the 42 homes that only 5% of those actually had it operating, there's supposed to be a label there. In 12 of the homes that did have a label, 58% of them had it operating. The labels, the quality of the labels also varied. Okay, so you see on the left, continuous duty. I wouldn't know what that meant if that showed up on a switch in my house. But if I have a little label that says to maintain minimum levels of outside air ventilation required by the state of California, this fan should be on all times when the building is occupied unless there's outdoor air contamination. That is going to maybe tell me I should leave the thing on. Here's a couple others: keep fans on at all times, whole house ventilation control, etc. Another big study of ventilation was done in Austria. They were asking the question, does mechanical ventilation provide healthy and comfortable interiors? And do the systems convince consumers? So they studied 62 low energy or passive houses that had mechanical ventilation, 61 conventional construction that did not. This was built in 2010 to 12, so similar era to what we had. Mix of detached and attached homes. They measured indoor air quality at 3 and 15 months, and they surveyed the people living in the homes for their perceptions of satisfaction. So what you're looking at here is a histogram of formaldehyde concentrations, comparing the natural to the mechanically ventilated. So you see the mechanically ventilated as a group had lower formaldehyde levels than the natural, median of 27 micrograms meter cube instead of 40 for the natural. So similar to our results, ventilation seems to make a big difference. The mechanically ventilated homes had higher satisfaction percentages, people saying that the air was fresh, clean, and pleasant. And then lower percentages of people saying it was stagnant, stale, or stuffy. I don't remember what the real question was about sausagey, but I think it was odors. It had to do with odors. I just assume it's Vienna, so it must be sausage. Now that study we did in California is being expanded, a similar study at locations around the U.S. Pacific Northwest National Lab completed sampling in Oregon and Colorado. Florida Solar Energy Center is doing the Southeast, and the University of Illinois is doing Illinois. A lot of the data has been collected so far. We're going to try to get half of the homes that have mechanical ventilation and half without. Results to be determined. So we're still waiting to see. Preliminary results, so far, we have not seen differences as large as what we saw in California, but we're also seeing in a lot of these other places, the mechanical systems are not as effective in terms of meeting the ventilation airflows that they're supposed to. More on that in the coming years. In the Southeast, I mentioned in California, they're mostly exhaust systems. In the Southeast, there's a concern about exhaust ventilation. Not clear whether it's well justified or not, but the concern is bringing moist air through the envelopes. So they have other options like this energy recovery ventilator, the ventilating dehumidifier. Some do use an exhaust fan, simple exhaust fan, or a supply that's integrated into the central fan. So far, I've talked a lot about single family houses, kind of market rate, single family, relatively large. There's a question of, well, what about low income housing? But in other countries, it's called social housing, that's either subsidized or provided by the government. Jeff Siegel led a really nice study. He's up in University of Toronto. Since that was Toronto, they called it social housing. Their review of the literature found that social housing residents are exposed to higher PM 2.5, but it's heavily influenced by higher smoking rates. They did not find evidence of higher levels of other pollutants. That's a good thing. Really poor thermal comfort. There was strong indicators that reside in social housing is associated with negative health effects, a high respiratory that's partially the underlying population being poor and live in limited health, poor, stressful, frankly, so being more working class, it's harder. People have more health issues. That carries through to how they interact with the housing. And they mentioned that green retrofits have the potential to improve IAQ, but they must be tailored to each building. And I'm going to mention that in an upcoming slide. I just want to mention flame retardants. They're in both solid and spray foam, with the idea that without the flame retardants, the foam will be very flammable. But these flame retardants really have quite a lot of evidence that they could be long-term chronic health hazards. And there's a couple of these different chemicals. Foam is being installed in lots of houses for its performance capabilities. And there's a growing concern, I think, for whether or not that's going to lead to long-term health hazard. And precautionary principle, of course, is if we don't know the consequences of something, maybe we shouldn't do it. So, I think we're rushing in to put too many flame retardants into too many houses without having adequately assessed the hazard. Just one slide. I just want to mention climate change, flooding. Lots of ways that moisture condensation, water leaks can cause moisture damage and increase mold risk, but certainly flooding is catastrophic in terms of dampness and mold risk. Even when you tear everything out of the house, unless you replace all of the materials, then those materials kind of get seeded and mold regrowth can happen much more quickly. One of the issues with indoor air quality is that we don't have the same kind of data that we have. I've showed you lots and lots of data from studies that were done, but they were tens of homes here, big studies were maybe hundreds of homes. You saw that one VOC study that was thousands of homes. From outdoors, though, we have outdoor air quality standards. And in conjunction with that, with the Clean Air Act, we have a nationwide monitoring network that continuously monitors and records air quality for a number of pollutants all around the country. So we can do things like look at that plot to your left, where we can over time look at PM 2.5 and see that, on average, and both the and even at the 90th percentile, that's that top one, PM 2.5 has been decreasing over time. So we can really track the progress in a very systematic way. Happily, we have these low-cost sensors now, which helps us with air quality monitoring. Are devices that cost anywhere, less than a couple bucks to could be hundreds of dollars per sensor. But a lot of the sensors that are being used in air quality monitors are maybe in that few dollars to $20 range. So the sensor reads something from the environment, it reports data through some mechanism. It could be a video display on the device. It could report it directly to, let's say, an air cleaner. It usually sends data up to the cloud. That cloud could display data on your computer or your smartphone, and then it could also save the data for. How can monitoring contribute to indoor air quality? Well, it allows us to measure pollutants that we can't see or smell, to identify hazards and sources, identify cases of low ventilation. We could directly activate controls. And then at the higher level, we could maybe assess the benefits of implementing some control or retrofit, track performance over time, and quantify indoor air quality. Those bottom three are much harder because you need really good quantification for those, whereas the top ones, just being able to reliably detect what's in the air and when something changes. So a semi-quantitative response can allow you to manage your air quality, even if you don't know precisely what the number is. Growing number of studies that look at using these indoor air quality sensors for smart home controls, and especially for particulate matter. As we mentioned earlier, that's the kind of the biggest hazard in a lot of homes. So this was a study where they, I think it was a Dilos there. So it's a $250 or $300 air quality monitor. They connected that up to the home's HVAC system, which had filters in it. And then they ran it under normal operation. They ran it with the fan on all the time. And then they ran it in the smart mode where the fan only came on when the PM 2.5 detector detected high enough levels to initiate the fan. And what you see is that you actually had substantially lower PM 2.5 indoors, certainly when the fan was operating continuously, but also just a smart system. Okay. By the way, I just picked up, Charlie had asked, in the states that do not require mechanical ventilation, where would we find data about how many homes within those states actually lack mechanical ventilation? I cannot tell you the answer to that, Charlie. And if you find the answer, I hope you tell me, because I have not found systematic data on that. It's knowable, but not known. Are there any reasonable ways to measure indoor air quality in my home? Well, again, we've seen these monitors. I commend you to some of the papers we've published on some of the PM 2.5 monitors. Can you please address COVID and the risk with tighter homes? I think I did that already, but I'll try to come back to that at the end. Here's another study. So this is a study looking at a portable air cleaner with a sensor-based control, and SH is sham, AD is user adjust, and AU is auto. They looked at two different locations, putting it in the kitchen, putting it in a living room, and then average, and you're looking at the distribution of hourly mean PM 2.5. So these box plots, I probably should have said this earlier. The middle part of the plot is from the 25th to the 75th percentile. And then the lines go to kind of, usually it's 1.5 times the interquartile range. Basically, it gives you a sense of most of the distribution, and then the individual points are the people that are outlying. So the kind of the unusual hours. And what you see, if you pick the kitchen one, for example, the red is outdoor. Sorry, the red is indoor and the blue is outdoor. And you see indoor higher than outdoor. So there's more indoor sources in this house or across these homes. Sorry, I think this is multiple homes. And but what you see is that with the sham, much higher indoor than outdoor. Adjustable, it's reduced, and with the auto, it's also reduced. So instead of having to play around with it yourself and decide when to turn on or off, you can just run it in the auto mode, and you can know that you're going to get a substantial reduction. In terms of the value, I mentioned that we have this outdoor air network. Well, these cost monitors are being deployed by just people who buy them and put them outside to be part of this crowdsource of data collection. So by far, I think the most popular one is this purple air monitor. You see they're all over the country. You know, probably not that dissimilar to the spread of the air monitoring sites because they're more weighted toward population areas. From this, you could see some of the red areas, like in California, we still have some fires in California. So we're still seeing smoke in certain places in the Central Valley. And then up in Washington, you see a couple hot spots as well. The resolution of this stuff really varies a lot. So you see off on the left there is Pittsburgh, quite a lot of these things around Pittsburgh. You go to the Bay Area and they're just all over the place. This was again from this morning. You see east of where I am, on the other side of the hills, there's quite a lot of yellows, oranges, and reds, especially where they're still getting fire smoke coming from that Central Valley fire. And then you go to a place like State College and surroundings, and not so many of those monitors around. Now, I'm guessing you have pretty good air quality there, so maybe there's less of a need for it. Every time there's a wildfire here, we see a lot more put up. One of the interesting things that these monitors, they have versions for outdoors or indoors, and it's good to see many, many, many more indoor. That's the ones with the circle around them. So all these homes are homes with indoor. And what's nice is when there's a fire, you can see way lower concentrations indoors than outdoors as people take precautions to protect themselves. So what can we measure with these low-cost monitors? For monitors, it costs less than $3, which I'm putting in the, affordable to many, though not to all. We can measure particulate matter, radon over time, carbon dioxide, carbon monoxide, temperature, humidity, and an indicator of volatile organic compounds, though it's just non-specific. And then to measure other ones, you got to go above $500 to measure, for example, nitrogen dioxide or formaldehyde. And then black carbon ultrafine particles, there are monitors, but not really low cost. They're really actually pretty high cost. One quick note, Jeff Siegel mentioned this about the benefits of doing green retrofits. So there's increasing attention about whether we can, at the same time as we energy retrofit, can we also improve the air quality and health. We did a review of the literature. We looked at 4 different kinds of retrofits. From to added ventilation as part of the green, and then especially in Europe, there are quite a lot of these warmth retrofits that are aimed at basically reducing very cold temperatures in housing that is not adequately heated. We reviewed 36 studies, covered in 44 paper, 2 reports. There were 15 basic retrofits, ventilation added 4 green and 13 warmth, mostly in the US and Europe, mostly from cold winter climates, and mostly focused on low income. Just a couple of highlights. So in that review of social housing, we saw that people's experience, people had the experience of bad air quality and health symptoms. So we find that when you do these retrofits in homes, these energy efficiency green set of retrofits, and just a note that the different retrofits are color coded here, from the basic to the ventilation added is the blue, the green is the green, and then the warmth retrofits are the pink ones up top. You see pretty consistently substantial benefits of these warmth retrofits for a number of parameters. This one is a change in dampness and mold. So by doing the retrofit, we reduce the percent of homes that report a dampness or mold problem. The green is a significant, the dark is a significant result, the light is a non-significant result. We view our study, we judge and it's not an S or a W, it's just a middle ground study. We saw improvements in temperature on the left. It's the change in discomfort. So there's a reduction in discomfort and an increase in comfort. Again, with most of these retrofits being focused on warmth, and we saw substantial improvements in comfort conditions. In terms of measured air pollutant concentrations, we saw more of a mixed bag. We saw, for example, the formaldehyde concentrations increased when you green retrofits, we saw them go both ways, and there were no formaldehyde measurements in the warmth retrofits. There's nice improvement retrofit. Okay, so title of the talk was Advances, Opportunities, and Challenges. So the advances to review, we have improved outdoor air in many urban areas. I had only can assure you it's true. So that means that that's not. We see a much lower pollutant exposure. Filtration, you can get low pressure drop MERV 13 and better filters for your residential systems. And to do that, and reduce outdoor pollutant infiltration. Those are not just reducing air infiltration, but there's also better insulation and better moisture control. Radon testing and mitigation is really well developed. Some real challenges. I didn't really talk about standard housing because it's a whole issue in and of itself, but sadly we have a lot of standard housing. Very optimistic that there's a structure and massive programs for retrofitting homes, and that can help with fixing the house at the same time. Tighter envelopes can increase your risk if they're not done right. So we need to pay attention to how we do it. Big challenge is increasing frequently wildfire smoke events, leading to really terrible outdoor air quality and resulting indoor air quality exposures. Potential hazard posed by flame retardants. There's still actually a lot of deficiencies in general in kitchen ventilation. And then with the changing climates, we're going to have more flooding, more wind and heavy rain. So that could lead to moisture intrusion and also more heat. Some really good opportunities. Indoor air quality monitoring. So that is going to give us a view into what's happening in many more homes. I just had a paper to review today, very happily, someone using that purple air data to probe what's happening inside homes from the indoor purple air monitors. I think we're going to see a real explosion in sensors for robust fault detection diagnostics. Lots of things in homes don't work well generally. It's a fine line because, you know, when if you happen to have a fancy refrigerator to tell you to change the water filter, we kind of ignore that for months at a time. So that having the sensor doesn't necessarily help us. I'm not proud of it, but it's just the way it is. But hopefully that will also help, for example, AC technicians to more quickly diagnose when systems are not working correctly, and then much more efficiently repair them, maybe by telling them remotely what parts they need so they can make one trip instead of two. Smart ventilation, so figuring out when you need to ventilate, maybe linking it to air pollutant concentrations inside and out. And also for energy, increasing the role of manufacturing. I didn't talk about that here, but I've looked at your past talks, and maybe you'll again have talks on manufactured housing. Really improves quality and lowers costs. And then I think there's a real opportunity to combine energy retrofits with healthy homes measures. But importantly, there are different measures that you take to improve the air quality, the comfort, and the healthfulness of a home. That some of that overlaps with energy efficiency, but it's not the same set. So you need to actually do both sets of measures, not just improve energy performance and think naturally everything's going to magically get better. So that's my last slide. I went than I had planned. Hopefully there's still a few people on the line, and I think I've answered the questions, but if anything wasn't answered,